the technique. How do we do this? It's actually quite easy. Again, make sure you take the time up front to have the patient comfortable in the patient's arms. I typically start at the epigastric region. Now remember the linear high frequency transducer, the indicator typically oriented towards the patient's right. And what you're going to do is find the liver edge and follow the liver edge, because at the right upper quadrant, that's typically where you will find the intussusception. Now, if you don't find it there, you can do what's called the lawnmower technique. You can go up and down throughout the abdomen to look for the intussusception. But remember, at the right upper quadrant, that's the most common location to find it. And what are we looking for? So this is in the transverse view. We call this the target or the donut sign. And then remember, you want to obtain two views. And in that second view, you have the longitudinal view. We see here the intussusceptum going into the intussuscipiens, and this is called the hayfork sign. The longitudinal view, where the intussusceptum goes into the intussuscipiens, is also called a pseudo-kidney sign. Now, I've not seen this very often. This one maybe looks like a kidney. Yeah, I think it requires a lot of imagination, but just know this is another name for that view. This almost looks like a kidney here, and side by side, there's a kidney.